It is normal for the weather to be changing as we move seasons, but why are we here today to talk about cold weather, Simon?
For most of us, it's absolutely fine. We keep warm, we can dress up, put hats and scarves on. But for some more vulnerable people, it can really affect them.
So, Simon, I've been really worried about my grandma recently. She lives independently, she lives at home.
As people get older, they are less able to cope with the changes in temperature.
What are the top tips that we can recommend to help people to stay warm?
One is about keeping moving, so whether that's in your home, if you don't feel able to move very much, just your fingers and toes and just kind of wriggle around a little bit. Think about the layers you're wearing, whether you can put a base layer on. And then also which rooms in the house you heat. If you're worried about heating costs, keep one room warm so you can stay warm in that room. And then also, are you up to date with your vaccinations, whether that's a flu vaccination or a COVID vaccination? Really important to stave off illness with those vaccinations.
And are there other groups that we should be offering advice and support to?
We also need to think about those other groups of people less able to cope with cold weather, so that's young babies and children, and also people with long-term conditions who may be less able to regulate their temperature.
Is it just the physical aspects that we should be thinking about?
People's mental health is also really important. Some people struggle more in the winter, so there's a few things that people can do. Connecting with others, maybe making a phone call to a friend or finding a group of people to connect with. Also think about being active again. That's also good for our mental well-being.
Especially on the doorstep of Hampshire.
Absolutely, there's many beautiful places around about us, around our houses, in the parks and the countryside that we can enjoy.